The Confess Project of America is a national mental health movement, recognizes America's first mental health awareness movement, who historically have trained barbers, stylists, and frontline workers, over 5,000 of them, to be mental health advocates. We developed a curriculum that really utilizes a lot of the same pillars as DBT, which is a dialectical behavior technique, which a lot of therapists use in talk therapy. So we've utilized the framework of DBT and really brought that to a component of supporting marginalized and underserved folks.
Great. Well, hello, Lorenzo. Welcome to the podcast. How are you?
Doing well, doing well. Thank you for having me.
Awesome. Well, I'm excited for our conversation and really want to just dive in if that's okay with you.
Absolutely, absolutely. So I come by way of this work, due to my connection of working in philanthropy after serving a tenure in public service and in the state government, working in Medicaid services for Health and Human Services. I was encouraged to step out by a friend who had done a lot of work in promoting girls' social emotional learning, who really encouraged me to think about my purpose and my story and how I can bring that to the forefront. And so, I began to as I begin to take on work in working for the Rockefeller Foundation as a organizer, I start to reimagine how my story and purpose could really help to ignite opportunities in the sector. And so I had came from also a prior background of working in the mental health sector, but also, I had a personal journey and story being diagnosed with depression, being born in jail to an incarcerated mother. I lost both my parents before I was 21. I had recognized that I went through a lot of different challenges, but also recognizing what brought me to public health was pre-COVID. The conversation about mental health was not being talked about. In 2016, when we started the organization, this conversation was super foreign. It was super uncomfortable. It's still uncomfortable today, but it's much more progressed than what it has probably ever been, ever. And so believe that, we were on the cutting edge of where we are now to getting to this moment and this perfect moment that we're in. And so knowing that the work that we started with was Black men and young Black boys, and the mental health and the opportunities access to mental health care was not really recognized and seen. And so that's where this mission and vision started. But it also really connected to my own personal story, being in a behavioral health institute at the age of 10 and being diagnosed with depression, having family members who had been diagnosed with bipolar disorder and different various other different mental illnesses and challenges. I knew that myself had an advantage with my academic experience as long as my personal and professional experience to really be a thought leader and a visionary in this space. So
Wow. Well, I mean, first and foremost, I think it takes a lot of courage to step out and to build a career and a direction and a platform and to advocate, the way that you are. So I applaud you for that. And I know that it's inspiring for me personally to hear and to witness. And I can imagine, how that has been such a part of your growth, I would imagine,
yeah,
and the impact that you're able to have. That truly is public health right there.
sure.
Just for kind of the record here, I know in the beginning of the episode, I've fully introduced you because that's typically how I do it. But in your
Yes,
own words, just kind of let people know a bit about what you do now. How do you
yeah,
serve? What is it that you do?
absolutely. So after an 8-year tenure, we began to hire, C-suite staff over the last few years, and we're now in our third leadership round. After 5 years, I began to reimagine my leadership and how that would look. And so I'm still obviously an emeritus member of the Confess Project and the work that we're doing. The work is now led by Jordan Lewis, who's affectionately my wife as well. And so we have continued to elevate and uplift this work to take it to the next level. My current role and how I support is as an emeritus member and a global spokesperson of the work that we do. I'm continuing to also reimagine opportunities of social impact. And so one of that is we are now developing an initiative, for-profit impact initiative that will support hospitals and emergency rooms and how we utilize the behavior health workforce, utilizing those same barbers and stylists that we've been able to train into this curriculum that we've had, but also allowing them to be a part of working with hospitals on reducing costs in ER rooms, reducing hospitalizations, as well as helping to amplify the behavior health care workforce as well as the healthcare workforce, as we know that there's a shortage. And so we're wanting to really collaborate community folks, frontline worker folks with hospital sectors. And someone like myself who's come from working in mental health hospitals for years, I've worked for over 6 of them in my 15-year tenure before coming to this work. I know that we need more cultural humility. We need more connection with our community, and we really need more collaboration to ensure that there is a smooth process of individuals who may be going into care, or that we're providing prevention for individuals who may not even need to be hospitalized in the beginning. And so we're looking to now build that model out. It's called Confess Health. And so it will be working with hospitals and ER rooms to providing those solutions.
So you mentioned Confess Project of America. So
Yep.
can you explain that a little bit more for people that may not be familiar with it?
Absolutely. So, the Confess Project of America is a national mental health movement, recognizes America's first mental health awareness movement, who historically have trained barbers, stylists, and frontline workers, over 5,000 of them, to be mental health advocates. We developed a curriculum that really utilizes a lot of the same pillars as DBT, which is a dialectical behavior technique, which a lot of therapists use in talk therapy. So, we've utilized the framework of DBT and really brought that to a component of supporting marginalized and underserved folks. And so this curriculum looks as if a mental health first aid, to give an example, it gives an idea of how that looks, but it really focuses on marginal and underserved communities in returns of active listening is one of the pillars. Validation is one of the pillars. Positive communication is one of the pillars, and stigma reduction is one of the pillars. So we have modeled this and piloted this over the years. It's an evidence-based curriculum where we've been internationally published, working with researchers at Harvard and the School of Brain Injury and the School of Public Health to ensuring that this curriculum can continue to grow and impact others. It really shows a lot around those barbers and hairstylists being suicide prevention gatekeepers, mental health gatekeepers, as well as helping to decrease domestic violence and interpersonal community violence. And so we've trained over 5,000 in the last 8 years in 35 states and 63 cities. Right now, we're impacting 500,000 people per month, up to 5 million people per year. And so each person that we've trained in those communities are reaching about 25 people per week with this training that they've went through. We measure it through the lens of stigma reduction and how we've increased their understanding about mental health, not so much about who's going to therapy post them going through this training. And so that's what we plan to do, as I talked about with the new initiative, Confess Health. We plan to evaluate and then work with hospitals to do a little bit more of that research and granular focusing on individuals who are coming through barbershops and working with, working with our healthcare systems. We plan to do that more further in that work. But in this particular work with the Confess Project, it's really focused on education and prevention. So,
Yeah, that's amazing. So who are the partners or the clients for Confess Network? Are you looking at hospital systems or government agencies? Like who would be
so
the client?
over the years, we've modeled this training. Obviously, what our target market being barbers, black barbers, and hairstylists in the black community. That has been our target market over the last 8 years. However, we have worked with government agencies, we've worked with hospitals, schools, nonprofit organizations, peer recovery organizations, peer led movement organizations. We've worked with all of those different organizations. What we're recognizing now is that we want to be a force in helping to bolster the behavior health workforce and increase the healthcare workforce by ensuring that barbers and stylists and frontline workers can be more involved and participatory in the process. And so that's what we're doing now through our new initiative. But the Confess Project of America, we'll continue to host those barbershop talks and those trainings across the country as a early start, because that's what we've historically been known for. But we are diving deeper into wanting to work with health sectors. Just for an example, we're working with UAB, which is one of the larger health systems in Alabama, Birmingham, and across the Southeast region. And so we're going in working with healthcare workers there, working with the Department of Public Health. We'll actually be working with them in November in partnership to also working with the Pastoral Institute there in Birmingham and barbers there on the ground. So very still community oriented work, but the hospital is serving as a conduit to helping bring all of these folks together so we can amplify the message.
So what is your I'm intrigued now. What
Yeah.
is your team look like? And because you're covering a lot of, base here.
Yeah, absolutely. So we are a team of over 60 years of experience in mental health, behavior health, psychiatry, business development, marketing, from a range of different fields. We went through a lot of evolution over the years, as you can imagine. And I'll talk shortly about our partnerships and how did we get here to being able to reach millions of people a year. But right now, we're working with folks who are academics, who is doing groundbreaking research at institutions, all the way to people who served in policy and mental health for congressional committees in DC, to working with mental health facilitators who are LCSWs and LPCs across the field. And so we're in a myriad of different experiences that we bring to the table. Also, just a lot of healthcare background. A lot of our team members possess that as well. On our website, it's a very limited amount of people that folks see, but there's over a group of 30 individuals that work with us. And so we are looking to update that in the future, but for the most part, we have a broad team of people that we do a lot of project-based work with as well. So,
Yeah. That's impressive. And it's inspiring to hear. I'm just really wrapping my brain around it, but I can imagine my listeners are feeling very much the same way. Like, how do I help? So I know we're going to have links on our show notes page for
yep,
people to explore your website and to be able to, connect with you for, next steps and more support. Keep doing what you're doing. I know
absolutely.
personally, about 2 years ago, I cut all my hair off, went natural, and then I actually started, I don't know, I got my stylist kept going lower and lower, and I just need like a barber to just cut my hair. So I
Yep,
went into our
yep.
local barber shop,
Wow.
and I friended a guy that I think he's like the owner, the manager, but he just said, I got you, Doc. He just started calling me Doc.
Yep, yep,
So
yep,
I developed a relationship. I got accepted right in. And whenever I go in, I remember feeling like, oh, wow, I'm on the inside. I hear about, the barbershop culture and the talks. I
yep,
mean, I had,
yep, yep.
my boys were little. I dropped them off at the barbershop and then, I'd move on, do my thing. But I feel the connection there. And I know that like I can sit in the chair, I'm getting my hair cut
Yep,
and the
yep.
conversations are real in the barbershop. And they don't filter anything because I'm there as a woman, but
Absolutely.
I'm included in the conversations. But sometimes I'll get, and my name there's Doc. Everybody's like, Doc, you gonna give some free advice? I got a question, and they'll, roll
Yeah.
out with the question. But I so appreciate the community and the
Mm.
relationship, and
Yep,
truly see how they are influencers and
mhm.
connections to the community and
Yep,
and
yep, yep.
individuals.
Yeah, I love it. No, absolutely. And we always, I think you may know this. What they say is, what goes on in the barbershop stays in the barbershop, right? So
Yeah.
I'm sure that you have been a part of hearing that, or at least noticing that phenom coming to light.
That's
So,
right, because 'cause I'm like, "Oh, well, I'm in here now, I can't act like I'm uncomfortable." This
yeah,
is
yeah,
like
yeah, yeah, yeah,
I take it as more of as being flattered because they're comfortable enough to continue the conversation with me right there and
yeah,
for me to be a part of it, but I have such respect for I know that from the being in beauty salons, and how I would connect there. I know that experience, but this is
yeah,
very new with the barbershop, but I just just a whole new from being there personally and just a whole new respect for supporting preserving that and
yeah,
supporting that culture and that
yeah,
that community and
yeah.
that space. So just a personal reflection of how I can appreciate what you do.
Yeah, thank you. I
Um,
appreciate that. Absolutely.
yeah, so I just have a couple more questions for you, and then I'll let you go. I just enjoying this conversation.
Absolutely.
I think for people that are listening, I feel like on one hand it's like an obvious connection, but I do want to know from you, as you have an advanced degree in public health administration. Is that correct?
Public administration. It was
Public
more with a
administration.
focus on public service, but obviously my undergrad was in health and human services. I went to a HBCU back in Arkansas, Arkansas
Yeah.
Baptist College, and Arkansas Pine Bluff. So yeah, but no,
Perfect.
not, but yeah. So that's pretty much what falls between that. Yep.
Yeah. So I guess my question for you is, you clearly have this you understand public health. So
Yeah.
how does the understanding of public health help you better serve the community and have a greater impact?
Honestly, when I came into this space, I felt so left out. Just to be really transparent, only because it was at one point I wanted to go and get an MPH, and it was at one point I thought about becoming a therapist, and I didn't, and it was a long while where it felt very lonely, to be honest, growing something of this magnitude and not actually having those credentials, but really being surrounded by a lot of folks who had, and so what public health did for me, it allowed me to, at first it was a frustrating connection because I felt left out, but then it became a divine blessing in itself because it allowed for me to think about how I can better collaborate with folks who may not have some of the same experiences that I have. And so the community based learnings that I had experienced, some of the connections that I had to the community and the cultural connections that I had to influencers and people that leaders that worked in communities, it allowed me to really appreciate it. I also felt like there was a big part of me being able to bring community-based health equity work into the field of public health a lot more closer than what it may not have been, at least in my realm. I can only speak from my particular scope of work. And so that's what really one allowed me to appreciate the field more and really utilize the strengths of the field. And so, but most of all, I think the one thing that I'm so proud about that happened was that we became a research organization as well, that utilizes research to increase our learnings and increase our models, outcomes, and impact. And so that has been a game changer. It really, we partnered with Georgia State and SAMHSA on pilot studies. We worked with Harvard. We're constantly now working with other institutions on future opportunities. UC Davis is one of our partners we're working with in the state of California that we're looking to do research with other opportunities in regards of increasing learnings around Black men and the African American community and suicide. And so that has been a joy for me to think about research and the opportunities of how it can help to bolster an organization's capacity. And so I'm grateful for public health and how that has provided value to our model. That has now it's taken our model to a state of sustainability long term as an 8-year organization that plans to do another 8 years and another 8 years moving forward. And so grateful for what public health and research has done to catapult our growth.
Love that. I love that. Okay, one more question.
Yes.
We have a variety of people that listen to the podcast. So, is there any bit of advice or tip that you would have for someone who's listening, maybe a student, professional, entrepreneur, but who's also interested in similar type of work that you're doing?
Yeah, I think, the first thing I would say is kind of echoing on the last part is like dare to be bold and really like tackle the idea that you're really wanting to focus on. Don't allow, imposter syndrome or any type of other, ailments of disbelief to take you out. Like we all have a place in public health if you're committed to helping others achieve their best self and their best interest of their well-being and health. I believe long as we have a core North Star around increasing that opportunity for folks, there's a place for you in public health. And that's something that I had to learn is that I may not have become a scholar directly or a obviously had a direct profession in this field, but it's become home for me because of bringing my value to what I've been able to bring to it, and it has really helped a lot. And so I think just leaning in on what you're good in and what you want to continue to take to the next level will always be something that's needed in public health. And I think that's would be my encouragement. And again, to not let imposter syndrome take you out. I think a lot of times we discredit ourselves so much when we really should be uplifting the asset of what we can bring to the field, and that to any field, right? Whatever that may be, whether it's broader medical field or whatever that may look like for individuals. Yeah, so I think those are just some sentiments I could share.
Thank you so much. This has been such a treat. I've enjoyed learning more about what you do, and I know we're going to keep in touch. So,
Yeah, absolutely.
um, I will provide all the links to your site and connect with you on LinkedIn on the show notes page for this episode. And I encourage everyone to check it. Make sure they visit the show notes page. I'll tell you more about that in just a moment. But I just want to thank you for your time and sharing so generously and for all that you do. Thank you for being our guest here. And yeah, it's
Yeah,
been great.
absolutely. Absolutely. No, so glad to be here. Thank you so much for the opportunity. Looking forward connecting with listeners, and hopefully this serves as a source of inspiration for those who are on their path in public health. So
Thank you so much.